Good afternoon and welcome to today's webinar presentation of substance abuse in times of national crisis, hosted by DISA Global Solutions. Today's presentation invites you to hear from Colin Woods, General Manager of DISA Global Solutions, and Bill Current, Founder and President of the Current Consulting Group. And with that, I'm going to turn the virtual microphone over to Colin Woods.
Thank you, Jessica, and special thanks to all of the attendees. DISA wanted to provide data and options for our network of contacts to assist them in making informed decisions. Since the middle of March, companies have been challenged with balancing existing safety processes against COVID safety measures. In some cases, this has included the suspension of random selections, as well as other occupational health screens for workers. Today's agenda will include substance abuse trends, affected industries, the costs and risks associated with not testing, legal and regulatory compliance, and finally, the post-pandemic workplace. As a call out, over 30 million workers have filed first-time unemployment over the last 6 weeks. That's a significant percentage of the workplace that's currently unemployed, but will be re-entering the workforce. We'll run through this presentation over the next 30 to 40 minutes, and like Jessica said, both the presentation and recording will be provided to all participants. Thank you for those of you that submitted questions during the registration. And again, please continue to provide those questions in the questions section. And like Jessica said, we'll collect them, answer them, and distribute them at a later date. And with that, it's my pleasure to turn it over to Bill Current from the Current Consulting Group. Thank you.
Thank you, Colin, and welcome everybody to today's webinar. We're going to follow the agenda that Colin outlined. And I just want to say from the very beginning, I'm going to just give away the final chapter of the book, so to speak, and tell you that I think it's critically important that employers continue to drug test during the COVID-19 pandemic, the shutdown, the lockdown, the stay-at-home orders. A lot of people are still working. Many people are coming back to work. We're going to talk about why you should continue testing and be ready for maybe whatever the new normal is going to look like by getting ready now for that future. As Colin mentioned, 30 million plus people have filed first-time unemployment claims in the last 6 to 7 weeks. That is an astounding number. And those are all people. First-time unemployment claims are people who 6 weeks ago were working, who are now find themselves unemployed, and as the economy begins to open up again, they're going to be looking for a job. They're going to be knocking on your door looking for a job, and we've got to be ready for that. Let's talk about some trends leading up to COVID-19. So as we came out of 2019, we received a report from the federal government, from the Substance Abuse and Mental Health Services Administration, that gave statistics on the levels of drug abuse throughout the United States ending in the year 2018. So that's the last year the data was available, and that report came out last year. As you can see, that second bullet, about 20% of Americans 12 and older used illicit drugs in the previous year. And that percentage is higher, has been higher every year since 2015. Significantly higher in 2015 and 2016, and about the same, but a smidgen higher in 2017 going into 2018. And I can show you some statistics that are going to help you understand how it's continued to go up. One of the things that's fueling that increase across the country is the legalization of marijuana. So 34 states have legalized medical marijuana, or the use of marijuana for medicinal purposes, and recreational marijuana. Every state in orange is a recreational marijuana state. It's illegal to use marijuana in California, Nevada, Oregon, Washington, etc. Every one of those states started with a medical marijuana law first. And so all the blue ones are the medical marijuana laws, and all the orange ones are the ones that started with medical marijuana and then legalized marijuana for recreational use. So the legalization of marijuana spreads across the country and is having a direct impact on the substance abuse levels that we're seeing in the country today. So as you look at that gray bar just below the long blue one, you can see that the abuse of psychotherapeutic drugs has started to actually decline. That's good news. These are the anti-anxiety medications, antidepressants, etc., that were becoming the focal point of so much media attention because there was a dramatic increase in the abuse of these substances. That started to come down. The bad news, as you look at the long bar at the top, is that at the same time psychotherapeutic drug abuse is dropping, the use of marijuana is increasing significantly. And you look at that red arrow, just below the red arrow there on the right of the screen, you see that in 2017, it was 15%. In 2018, it was 15.9%. That is, according to statisticians, a statistically significant increase. To see it increase from 15% to 15.9% in 1 year. And this is particularly troubling. This is from the same report from the federal government, and there's the source at the bottom, so you'll be able to look it up once you get these slides, is that the use in the last 30 days of the use of marijuana in the last 30 days has been climbing steadily from 2015, the light blue bar, all the way to 2018, the dark blue bar. And then if you look to the right, you see those shorter bars. Those are the percentages of people who admitted to using marijuana on a daily or almost daily basis during the previous year that they were interviewed. So you can see that went from 1.9%, 3.9 million, to nearly 6 million people admitting that they're using marijuana on a daily basis. So just 4 or 5 years ago, it was less than 2%. Now it's almost 6%. And so we're seeing a dramatic increase in the use of marijuana, which is contributing to the overall rise in substance abuse in the country. Now, let me just refer to substance abuse and mental health just for a moment, but for a very important reason. So if you look at that first column, the first three the grouping of the first 3 bars there, you'll see red is people who said they had no mental illness. The blue bar are people with some type of mental illness, and the green bar represents people who admit to having serious mental illness. And so those are the overall rates of substance abuse in that first grouping of bars. The next grouping is marijuana, then opioids, prescription pain relievers, and heroin. I point this out because I'm about to show you some statistics that show that in times of national crises, mental illness rises significantly. Depression, anxiety, fear, and then coming out of that, what mental health experts would refer or diagnose as post-traumatic stress disorder. And so let's look at this next set of slides. So after 9/11, a number of different studies were done that showed that substance abuse in New York, around the country, but especially in New York and especially in New York City, rose significantly as people began trying to self-medicate to deal with the depression, the fear, the anxiety, and in the months following, the sort of lingering mental illness that the effects of mental illness that they were experiencing in the days right afterwards. And so as you can see from the 3 bars on the right, cigarette use went up significantly, alcohol abuse went up significantly, marijuana not as much, but you have to remember, marijuana wasn't legal in 2001 in any of the states. So, you know, medicinal marijuana, the whole sort of movement towards medicinal marijuana came just a few years later. So we would expect to see a low or a smaller increase in marijuana use, but we still see an increase in marijuana. And the thing that's really scary is that the same study found that this increase in substance abuse lasted for months after the 9/11 event. So a very scary, traumatic, evil thing, right, happened on 9/11, 2001, and it affected our psyche as a nation and the mental well-being of people who were closest to it. And they self-medicated in many cases with cigarettes, with alcohol, with marijuana, and that number only dropped from about 30% to 27% 6 months later. So numerous reports. This is just one study that we're citing here. Now we find ourselves in the throes of another national crisis, another national emergency. And some initial studies and reports and surveys are already indicating that substance abuse is spiking significantly throughout the country. This was a survey, okay? So surveys are self-identifying types of question and answer studies. So individuals identifying that I do this or I don't do this. In this particular case, this was done towards the end of March, 3,000 working Americans for a study done by alcohol.org. You can go to alcohol.org and find this information, revealed that 26% of Indiana workers working from home admitted they were also drinking during the day, during their work time. Now, if they were in the office, not likely, you'd see that high of a percentage, of course. In Hawaii, the percentage was 67%. So 67% of people who were suddenly working from home, maybe for the first time in their careers, were admitting that at the same time they were drinking alcohol during the day. Virginia, New Hampshire tied for second at 50%, and I think it was Arkansas was at the bottom at 8%. Now, look at the sale of alcoholic beverages across the country. US sales of alcoholic beverages, that first bullet, rose 55% by the third week in March, compared to a year ago, according to a report done by the Nielsen organization. Tequila, gin, premixed cocktails up 75% at the same time compared to the same period a year ago. Wine sales up 66%, beer up 42%, and a significant increase in online sales versus in-store purchases. Well, many liquor sales are controlled by the state, and depending on the state that you're in. And so some of those stores initially closed, but then they reopened as governors felt the pressure to make alcohol and liquor available to the residents of their state. A lot of those purchases, however, were taking place online. Now, compare that to marijuana, legal marijuana. In most of the states that have legalized marijuana, 34 total, right? 11 for recreational, but overlapping with the 34 for medicinal. They declared marijuana to be an essential medicine in some states. And so it was available for online purchase and in some cases in-store purchases all this time during the pandemic. During the time that other stores and restaurants were closed, marijuana distribution centers were open for business. And the average store revenue increased, depending on the part of the country, from 52% to 130% compared to sales in January of this same year. So we would expect to see year-over-year increases from 2019 to 2018 or 2020, but we're talking about comparing March and April to January, 52 to 130% increases. Online buyers increased by 142%, and in various other places in the country, we saw spikes in marijuana-related beverages, edibles, and any type of THC product up significantly in various parts of the country. Here in Florida, where I live, marijuana sales up 36% in March. At the same time, I'm kind of building a story here for you. At the same time, the federal government identified certain industries as being essential industries that needed to stay open during the lockdowns throughout the country to keep certain essential services available to the people of the United States. No problem, no argument there. These are the ones that were designated by the federal government. And if you go to the CDC website, you see under each one of these subcategories of occupation. So it's massive. A lot of people were still working, even though in these essential industries, there were furloughs and suspensions and people being laid off. Now compare that to Florida, where I live again, and you can see an overlap with many of those occupations and industries that appeared on the national list. Okay, I'll leave this up for a second. Construction, restaurants. Here in Broward County, where I live, we had curbside restaurant services or drive-through restaurant services, but we didn't have in-store restaurant services. Waste management, factories, manufacturing facilities, etc. Construction projects that were already underway, already contracted, already licensed and approved were permitted to go forward. So a lot of those services and a lot of those occupations were considered essential and continued and have continued. At the same time, though, going back to that study from the federal government, SAMHSA, we know which industries traditionally, historically have the highest rates of substance abuse. And so these are just the top 5 in drug abuse. You see accommodations and food service, management, information services, and construction. Now here's the list from the same study on alcohol abuse: mining industry, construction, food services, utilities. Now here are the industries that have experienced the highest rate of positive drug test results over a 4-year period, according to one major laboratory. Let me read this so that I don't paraphrase it incorrectly. Starting with the quotation mark on the first line, retail trade is one of the 6 sectors that saw year-over-year double-digit increases in positivity results, positive drug test results, between 2015 and 2018. 5 of these experienced an overall 4-year increase in general US workforce, not DOT by itself or non-DOT, but the two combined. Positivity is more than double that of the national average. So the national average, 6.2% over that same period. In other words, it rose 6.2%. So the first line says transportation and warehousing. It's not saying that 34.5% of all tests were positive. It's saying that positive drug test results increased 34.5%. That's astounding to see a 4-year increase of 34.5%. Overlapping, not coincidentally, with the increase in states that have legalized marijuana for sure, but also if you look at this a year from now, you're probably going to see increases again due to the rise in substance abuse and alcohol abuse during the COVID-19 pandemic. But just going by this, transportation and warehousing, 34.5%, other services, 33.3%. There's a whole list of occupations there. Wholesale trade, 20%. Retail trade, almost 15%. Construction, we see that on almost all the lists, 13.2%. And other waste management, remediation services, 12.2%. So as I'm going through these statistics, think for a moment, why are certain occupations not on here? Because certain occupations have a historical tendency not to hire drug abusers, or they have traditionally been doing more drug testing, which has kept their positivity levels lower over the years. And if you go to the SAMHSA website, you can find this information broken down. It's an incredible study that comes out every year. It's called the National Survey on Drug Use and Health. Now, here are the industries, according to a study done by the National Safety Council, that have the largest number of workplace injuries. Service sector, transportation and shipping, manufacturing, installation, maintenance and repair, and our good friends, construction. What are you seeing? What are you noticing between all those last 6 slides? The rate of substance abuse in certain industries, higher than other industries. These are the industries that have seen better than double-digit increases in positive drug tests over the last 4 years. And these also tend to be the industries that have the highest rates of accidents in the workplace. Now, I want to come back to marijuana for just a second. This again is from one national laboratory that puts out a report every year called the Drug Testing Index. And this is the percentage increase in marijuana positives by industry. Transportation and warehousing up 33%. Other services like public administration, 33%. Construction, 27%. Wholesale trade, 24%. Manufacturing, 23%. Food services, 21%, etc. You see a direct correlation between the increased use of marijuana in specific industries leading to higher rates of drug abuse. And if I could go back just one slide, also correlating with the industries that traditionally have the highest rates of accidents, which leads to workers' compensation claims, which leads to cost. Now, let's look at what it costs not to drug test. And I'm not going to go through a lot of detail here, but I do want to refer you to the DISA website. So you could go to disa.com/calculator, and you can find a calculator where you put in certain numbers and it will tell you what substance abuse is costing in your company. It's based on a lot of data that comes from really good sources, and you can find that information on the website. We're not going to model it for you here. That would have been a little bit complicated in the time that we have, but these factors on this slide correlate with the historical data from safety sensitive industries like oil and gas, chemical, and industrial. And then when you get to the, hold on a second, when you get to the page on the DISA website, you'll put in your total number of employees in that space there at the bottom in the middle of the page, and the calculator will calculate all those numbers with the data that already exists in the database, and it will give you a report that looks something like this. It will tell you what percentage of positives you can expect and what that's going to cost you, as you see over to the right, depending on whether you're a safety sensitive workplace or a non-safety sensitive workplace, or if you have a combination of the two. It'll also project the number of positive drug tests by drug. And so if you do this, you'll find that substance abuse is costing your company money. And the most effective weapon in the war on drugs, if we want to use those sort of antiquated terms, has proven to be drug testing. I've been in the drug testing industry for 30 years. I worked for a third-party administrator many years ago before I started the current consulting group back in 1998. And I've dealt with companies that have been doing drug testing and started getting lower positive results and have come back and said to me, why should I continue drug testing? My positivity rates have gone through the floor. I want to ask them, well, why do you think that your positives have gone down? Could it be that your employees know that you're drug testing? That drug testing is a powerful deterrent to drug use? It's also an effective way to identify people that need help. So of course you want to keep doing your drug testing program, and you want to make sure that your program is working according to the circumstances. So I've had companies come to me over the last several weeks and say, you know, we're in this pandemic, we've got people working from home, they're not on the roads, etc. Or if they're on the roads, it's minimal compared to in the past. So why should I continue drug testing? Well, in addition to the cost, which is still there, and we know that these levels of substance abuse are spiking right now during the lockdown, and these people are going to be looking for jobs with your company in just the next few weeks as the economy begins to open up again, you need to be concerned about two areas of law. And let me just say as a disclaimer, I'm not a lawyer. I have lawyers who work for me, and they're pretty smart people, smarter than I am, and they tell me that there are two areas of law that every employer needs to be concerned about. One is called respondeat superior. Now, I've been dealing with respondeat superior issues for most of my career. In Latin, that means let the master answer, or in other words, you, the employer, are responsible for the actions and the behavior of your employees when they're representing you. Whether it's in the workplace or out on the roads, you are responsible for the things they do, for their acts when they're on the job, or when they're doing things as a representative for your company. So if you're allowing substance abusers to work for you and they're out there doing things that could cause accidents or harm to others, you, the employer, will be held responsible for their behavior. Even though you weren't there when it happened, you need to be able to come back in a respondeat superior claim and say, I made a good faith effort to prevent this from happening. I have a drug testing program in place. We do random testing. My employees know, and this happened despite my best efforts. But if you've discontinued drug testing for whatever reason, you no longer have that defense. And there's another area of law that Yvette and Randy tell me about, and that's called negligent hiring. That's when a claim can be made by somebody who was injured against you, the employer, based on the theory that you, the employer, should have known that this person you hired had a background that would have indicated some type of dangerous or untrustworthy character or behavior on that person's part. Your drug testing program protects you from that. Now, there are a lot of other things that go into it. I'm not pretending or suggesting that drug testing is it, the only thing you should do. In fact, there are studies that show that drug testing in combination with supervisor training, employee education, and access to some type of employee assistance program has the greatest impact on reducing drug abuse in the workplace. But drug testing is a key part of that. And during the pandemic, the federal government has come out and specifically said, DOT has specifically come out and said, the DOT required drug and alcohol testing regulations are still in effect. You must still continue to make a good faith effort to meet those random drug testing requirements. And I know of no state law that has suspended any of its drug testing laws or requirements. In fact, I was doing a webinar 2 weeks ago, and one of the questions that came in was prefaced by this statement: I know that random testing has been suspended throughout the country, but, and then she went on with her question, random testing requirements in states that have industry-specific laws like Illinois with its public works contractor law, or Kentucky with its mining industry law, and others, as well as states with the workers' comp premium discount laws, et cetera, continue to require drug testing, and almost every one of those laws also requires random testing in sort of a very similar way to the DOT requirements. In fact, many of those laws simply punt on the requirements and defer to, if not plagiarize completely, the DOT or SAMHSA requirements. And let me just put out just a couple of points that were part of the DOT statement that came out a few weeks ago, which is that if it becomes impossible to comply with certain parts of the requirements under DOT, you have to make a reasonable effort. You have to find some other way to get urine collections done, maybe using mobile collection services is what they suggested. And on this slide, it specifically says that if an individual you want to hire cannot be pre-employment drug tested, you cannot allow them to perform a DOT safety sensitive function until you get a negative result. Same is true for return to duty testing requirements. In accordance with the regulations, you may not allow a driver under the Federal Motor Carrier Safety Administration regulations to perform any safety sensitive function until you get a negative drug test result back. Now, under random testing, it says if due to disruptions caused by the COVID-19 national emergency, you are unable to perform random selections and tests sufficient to meet the random testing rate for a given testing period in order to achieve the required 50% rate for drug testing and 10% for alcohol, you should make it up by the end of the year. So large companies and companies with lots of drivers, for example, who have suspended random testing for the time being, are going to have a lot of random drug tests to do in the third and fourth quarters. But if you continue to provide random testing during the lockdown, during the pandemic, at the whatever reduced number of employees you still have on staff working for you every day, you get those drug tests done now, and the third and fourth quarter are just normal random selection, normal frequency rates for you that you would have been expected and you would have budgeted for anyways by the end of the year. In conclusion to my part, and I'm going to turn it back over to Colin, there are various state laws that you have to be familiar with. There are mandatory laws. Here in Florida, we have a voluntary law that offers a workers' comp premium discount to companies that do drug testing. There's lots of case law. California is governed by case law when it comes to drug testing. There's workers' and unemployment compensation laws that allow you as an employer to move to deny a workers' comp claim, for example, if you have a positive drug test result that you can include as part of your contention that the individual is not entitled to that compensation. And of course, you have to be aware of all the medical and recreational marijuana law requirements and restrictions. And in conclusion, let me just say this about marijuana. There's a lot of misinformation and misunderstanding when it comes to legal marijuana laws around the country. There is one municipality, New York City, in the month of May that enacted a law that bans pre-employment testing for THC, except for individuals in safety sensitive occupations. There are a couple of states that have severe restrictions in place, but there is no state that restricts random testing or pre-employment testing for marijuana of safety sensitive workers. Some states give you a list of who those safety sensitive workers are, but testing for THC is legal in every state, especially when it comes to testing safety sensitive workers. There are many, many reasons to continue drug testing now, but to be ready for when the pandemic ends and you find yourself in a position where you've got 30 million people trying to make their way back into the workplace so they can be employed again. And you want to have your drug testing programs in place, functioning properly when that happens. So let me turn the microphone back over to Colin.
Thanks, Bill. The next two slides really summarize what we believe is going to exist in this post-pandemic workplace. We've all been kind of firefighting over the last several weeks to adapt to these challenging times, and now a number of us are shifting our focus into trying to adapt to the new normal as we do go back to work and as we do try to continue these safety measures against COVID-19. And certainly that still involves social distancing. That's going to involve additional hygiene practices. But these are some of the other things that we wanted to call out. Substance abuse will likely continue to increase in the coming months. We've seen this historically, and unfortunately, the next several months are going to be telltale for people coming back into the industry, and we already had that rising usage of drug abuse. Industries and occupations that have been deemed essential tend to experience higher rates of substance abuse and accidents. Like I mentioned earlier, more than 30 million first-time unemployment claims filed in 6 weeks through the end of April. I mean, these are a significant number of people that will be re-entering the workforce in the upcoming weeks and months. And so certainly employers may be questioning the importance of drug testing and/or experiencing problems. But continuing an effective screening program, continuing with all your compliance programs are vitally important. You should remain committed to the drug-free workplace goals and absolutely rely on drug testing to help achieve those. Now, I will say there are different methodologies to perform drug testing. There are new norms like that mobile or on-site collection availability, but all of these things are to continue the focus on an effective program. And again, with those 30 million folks coming back into the workplace, definitely expect a flood on pre-employment testing. Now, things you can do in preparation for this. Review and update your drug testing policy. Time and time again, we ask clients, when was the last time you reviewed your policy? And a high percentage of them have not reviewed it in the last year. Several have not reviewed it in the last 3 years. Bill had that slide about ever-changing marijuana laws. So it's one of those things that you constantly have to be researching, reevaluating, and re-communicating out to your employees and their supervisors and managers. And those last 3 bullets are really all about employee education and employee training. Again, this new normal that we're going into is going to involve a lot of awareness with regards to health safety measures due to COVID-19, but also just the challenges around drug and alcohol abuse. So make sure your supervisors and managers are effectively trained so they have the confidence to know how to take action, but certainly educate the employees as well. It's required for DOT and certainly strongly suggested for non-DOT. So with that, I'd like to thank all the participants. We really appreciate you taking the time this afternoon. If you have additional questions, always feel free to reach out to DISA. We will be compiling the questions that have been asked during this session, as well as the ones during registration, and recirculating them. With that, I'd just like to say, stay safe and stay healthy. Thank you.
Thank you for your attendance today. This concludes today's webinar presentation.